Hello and welcome to the next edition of Luminary Voices with Dr. Peter Piot. Today we're going to discuss some of the surges we're seeing around the world, including in India. And with that, I'm going to actually ask Lakshmi and Ajay to join us today, introduce themselves, and ask you some questions about why we're seeing these surges. So over to you, Lakshmi and Ajay.
Thanks, Hannah. Lakshmi, I'll go first. Hi, Doctor. Thank you for your time and sharing your expertise. My name is Ajay, and I manage the geographic operations for India. I'm based out of Bangalore. As a nation, just to give you a quick brief, we're currently seeing a massive surge across. Several states, the government has introduced controls, which are day curfews, weekend curfews to regulate people movement. The whole medical infrastructure as such is overwhelmed, and there are shortages we are seeing across availability of oxygen, hospital beds, medicines in many of our cities and most of the cities that we are present in. Our testing infrastructure, super stretched right now. RT-PCR reports are taking, in fact, more than a week at times. Regarding vaccines, as you were talking, so far only people above 45 years of age are eligible, though this is changing from May 1 when all people above 18 will become eligible. We do anticipate that in the initial days, demand will surge and there will be, but over a period of time, I guess supply will take over and we should be able to ramp up. Before I really ask Lakshmi to tell you what we are doing as for our people in Accenture, I had a question for you. What's your take on this, let's call it humongous surge in the last 4 to 6 weeks? While yes, still some time ago, we believed that maybe in India we were immune and the second wave will really pass us through, which certainly is not true what we are seeing today. What really happened or what is really happening over here?
Yeah, Jay and Lakshmi, India at the moment experiences probably one of the worst epidemics in the world. Of course, it's one of the second largest country in terms of population, but this is much worse than the first wave. The hospitals are full, as you said, lack of oxygen, which is there. And I think it's a combination of multiple factors. There has been, festivals, as always, where lots of people come together. These are events, and we've got the Kumbh Mela. Of course, it doesn't happen every year, so it's hugely important. Up to recently, there was the wedding season. I mean, all events where you have lots of people together are really creating this high-frequency transmission events. And then there may be also a role for some variants. So the virus itself, so it's people's behavior, and it's the B1617 as it's called, although the jury is still out of there. But it is really a matter of great concern. Fortunately, you should say, India is the manufacturer of vaccines in the world. You're providing vaccines for the whole world. So it should be possible to have a rapid deployment of vaccines because there's a good history of massive campaigns for vaccination and so on. But it's really urgent, and I think there's no time for complacency.
Yeah, thanks, Dr. Piot. My name is Lakshmi, and I am the HR lead for India. And these numbers that we're seeing across the country, we're also reflecting within Accenture in India. And we are currently focused. It's very reassuring to know that hopefully we can get, once the vaccines get privatized here, hopefully more people, both within Accenture and outside, can get their vaccines. Within Accenture, we are currently focused on providing support to our people, either through a 24/7 complimentary teleconsultation service, not just for our people, but also their family members. We've put in place, COVID-19 handy emergency guide that includes information on, where can you get tested, the hospitals that are treating COVID patients, emergency state helplines, and so on and so forth. And just a couple of weeks ago, we also offered people complimentary health checkup packages so they can proactively manage their own health. And of course, we have our own ASOC helpline numbers. But the questions that keep coming back to our people is, there's a lot of rumor right now around, is this virus now airborne? And is that how it's spreading instead of person to person? And therefore, are people wearing cotton face coverings? Is that advisable? Should they instead be wearing surgical masks? And sometimes, you also hear things about wearing double masks. Again, just in the interest of advising and sharing, providing right guidance for our people, what would your suggestion be, Doctor?
Well, thank you, Lakshmi. Well, this is a big question, and I think, first of all, it's fantastic that as a company you're dealing with this, because it's affecting everybody now. And and good practice starts at home, in the company, but the workplace, but also at home. A lot of transmission is happening in the family context, in the household context, in addition to what I mentioned, the big gatherings. And certainly my advice would be, and sorry to say so, the season may be over, but no weddings and all these big events, to avoid that, because it's putting you at high risk. And then you can take the basic precautions. I mean, as you say, keeping distance, but that's not always easy, certainly not in very populated areas. But masks do protect. They protect actually yourself and the others in case you are infected. But they have to be wear consistently. You don't have to go to the high quality surgical masks. Okay, that's in hospitals, and when you care for somebody, yes, that's what I would do. But it's consistently use them. That is if you don't wear it, you have it in your pocket, then it doesn't work. I mean, that's as simple as that. And people kind of ignore that. But it's true that there is airborne transmission that can happen. So that's, although most transmission is more short distance through droplets, but that's why closed rooms that are not well aerated is a problem. And now with the hottest season coming up, that could be another issue. So I would even recommend, if you meet people inside, to wear a mask. Because perfect aeration, you can plan for that, but you can't organize that overnight. So it is now going to be a collective effort. And many countries have demonstrated, if you apply all that it works. The number of cases go down. But it has to be done in quite a rigorous matter. And then also, I would say, there's a place for testing in case people come to a workplace, have to go to places that will also be, then we can make sure that those who are infected are not mixing with others and have to go in isolation. I would also say that if you have any symptoms that could suggest COVID-19, stay home and don't mix with others. And myself, I just, I'm a bit of a workaholic, so I just go to work. But now I've learned that's not good. If you stay home, and then you can limit the spread of it. Because every single person who's infected with the coronavirus and as COVID was infected by another person. It's as simple as that. This doesn't come out of the sky, or it comes from mosquitoes or whatever. So it is our own behavior not only protects ourselves, but contributes to controlling this epidemic. So it's both egoistic, selfish, but also altruistic. So that's a win-win, as they would say in business school.
Thank you, Dr. P.